News Talk 1340 KROC-AM. Good morning. I'm Andy Brownell, Rochester Today on a beautiful Friday morning, along with T.O. Tom Ostrom's back off of his assignment. Welcome back to the studios, Tom. It is wonderful to see you.
Well, you too, Andrew.
Been looking
Thank you.
forward to this show all week long.
Oh, gee, I wish I had prepared something.
No, I just love our conversations, and you can call in and join that conversation as well anytime during the next hour at 282-1234. I do have a mailbag. Don't have mailbags very often. But
you do, but you're so shy you don't tell us about them.
This is
you
something,
get nice compliments and you don't brag.
This is an event coming up next weekend, and I was completely unaware of this until a good friend of mine who has long served with this military unit and has, oh boy, I mean, if you look at the sacrifices his family has made over the years, and I imagine that other members of this unit have made similar sacrifices over the years, especially since the 9/11 terrorist attacks with the numerous deployments that they've had to make. Thankfully, at least my friend, his deployments have been in the U.S., but I know other members of this unit have been overseas a number of times. But the Rochester Army Medical Companies, and it's actually 3 companies because they've changed their unit name over the years, they're celebrating the 50th anniversary of them being here in Rochester. And a lot of Mayo Clinic and Olmsted medical folks are members of these Army Reserve units, and they provide nursing care and even physicians as well as other support care for military operations. And they're going to have their 50th reunion next weekend. And they want to spread the word because if you are a member of any of these units, and boy, oh boy, I got to bring up the units. It was Company B, Company C, and it's the 7212th is what it is right now. And it has been since 1990. But it dates back to 1964 that they've been stationed here in Rochester and have been involved in military operations. Mm-hmm. And they want to reach out and make sure that if you're listening to this and you haven't received the emails or not on Facebook or anything like that, and you served with any one of these Army medical companies here in Rochester, to be sure to get in contact with somebody. And you can go through the Convention Visitors Bureau. They have information about it as well. And you go to our website. There's a story on there that has information about it as well. And get signed up. It begins next Friday. There's events at the Kaler Hotel. But I know on Saturday there's a whole slew of events, and they're going to do a big event at the Soldiers Field Veterans Memorial next Saturday afternoon at about 4:30 in the afternoon. And they're going to get all these men and women together, and they're going to have a big ceremony, memorial ceremony for their comrades at the Veterans Memorial. And I know they have a lot planned for that next Saturday, the 18th. So there. If you know anybody who served with those units, get in touch with them and make sure they get involved with their reunion. It's a big deal. 50 years.
Oh, well, what a wonderful tribute and milestone. Well, I met a nice gentleman, Mr. Smith, who's a surgical technician at Mayo Clinic, I imagine at St. Mary's, in their surgical unit. And Jim Smith, he's an eclectic guy. He used to be a jewelry maker, and he got into surgical tech and advanced at Mayo. And, you know, I couldn't get him to talk much about himself because he wanted to tell me, speaking of military things, about his son, Paul Bryan, who's in the tank battalion and a sergeant at Fort Hood, Texas. So people serving our country, Andrew, that you mentioned, and this incident too, and Mr. Smith enjoys the show. That's my mailbag.
That's fantastic. We have a phone call, Tom. We'll do that before our break. Good morning. You're on KROC.
Good morning, Andy and Tom.
Morning.
Oh, hi.
Hi, Tom. This coming Monday evening at Autumn Ridge Church, we're going to hear from 3 Korean combat veterans. They'll talk about their experiences during the war. I know you've been talking about the military this morning already, but
yes.
Wilbur Sweets Anderson and Dick Fuller and Jerry Graff will be on the program, and this is sponsored by the Scott Hosier Veterans Roundtable. The program starts at 7. I'm sure, Tom, you know all about it. Wilbur was a signalman aboard the USS Sarcee. It was an ocean tug, and it was sunk by a mine in 1952. Dick Fuller was an infantryman wounded in Korea while fighting with the 7th Division. And finally, Jerry Graff was with the 1st Marine Division golly, we heard so much about this when I was over there. They were surrounded by the communist Chinese in the Chosin River reservoir. They were able to break out through being surrounded, but all the men suffered frostbite. It was a terrible time for the 1st Marine Division. So hope you fellas can make it that night, and people in Rochester.
And that's Monday evening,
That's Monday, right? October 13th. We don't identify names anymore on the air. If people want to, they can. So would you identify yourself, please?
Sure. Ken Thamert is my name, Tom.
And what
you and I did a nice...
We recognize your voice.
We recognize, but we don't say names anymore. We let callers do if they choose. It's so that's why I wanted you to say who you were. And Ken, you're with the Korean Veterans Breakfast at Grandma's Kitchen every Monday too. So you're very active, aren't you?
Well, we're going to be having a big national reunion this coming weekend. Here in Rochester, there'll be a lot of Korean veterans there, and it was in the news already this morning, wasn't it, about Korea?
Oh yeah, this is very interesting stuff. Yeah.
Yeah.
What is going? It's always what is going on over
What
there.
is going on?
Still ongoing.
Okay.
Well, fellas, thanks
Ken,
so much for your time.
Ken, first of all, the reunion coming up next weekend. So you also have a reunion taking place along with the medical companies as well.
Yes, and we'll be at the memorial on Sunday morning.
Oh boy, busy weekend.
Yes, we'll be having a 1-hour program there on Sunday morning. So
The time and the event, can you describe?
Golly, I believe it's at 10 o'clock in the morning, something like that.
Well, Ken, do you want to call us back next Tuesday and tell us about your reunion coming up as well? Because I'd like to hear about it.
Well, it's a get-together of the national members. They'll be here in Rochester, and I think our city was very, very fortunate to be picked by them, but the problem is you're trying to find locations for them to go to also, and that's why we're trying to get a museum in this city someday.
Good plug, Ken. Good plug.
Good. That's good how you maneuvered that in there.
Okay. Well,
very good. You have a great weekend.
All right.
Thanks.
Bye-bye.
Thanks, gentlemen.
Yep.
Bye
it's
now.
44 in the downtown at 18 past 10 o'clock, and Roscoe's Root Beer and Ribs. Thankfully, today would be a fantastic day. It's perfect weather to go down to the Root Beer Stand, 4th Street Southeast, and still enjoy that fish fry while you still have time before the snow flies. Icelandic cod, hand battered, and you get the choice of JoJo potatoes or the French fries. There's the coleslaw, and you get that delicious toast with it as well at Roscoe's Root Beer and Ribs. The world-famous Roscoe's fish fry is ongoing.
Yeah, the baked beans, coleslaw, garlic toast, as you mentioned, the fish and chips, and you can call ahead, pick up your order and go, or come on in and enjoy it in that nice, neat environment. And the root beer and ribs, and the barbecue pork, and the barbecue beef, and the great barbecue sauce, and root beer, and it's just like the old days.
That's right. The Root Beer Stand on 4th Street Southeast, the fish fry, still ongoing at Roscoe's Root Beer and Ribs. And don't forget the North location, which is up by Shopco North, and that's open all year round. 22 minutes past 10 o'clock. I'm Andy Brownell, along with Tom Ostrom, here on Rochester Today, KROC, and 282-1234 is our number. We'll be here until about 11 o'clock this morning. And what do you want to start with, Tom? I haven't seen you in a week.
Well, we haven't talked about this yet. It's complex, the bacteriology and epidemiology of Ebola. Mr. Ostrom, the state epidemiologist, he cautions us that Ebola, viruses mutate, and can it be airborne, and can we get it rather more easily than the people who don't want us to panic tell us? And Mr. Ostrom said that mutations could occur. Maybe it could be airborne. Unlikely to reach the U.S., said our president, and bang, it came to the United States. Our country doesn't seem to think it has a right to enforce its own borders, so we're not going to stop air flights from West Africa. People say it won't do any good, and we can't help anybody if we do that. But it's a dangerous, scary thing. 5 major airports are going to be very diligent about passengers, and the one closest to us is Chicago's O'Hare. and some airline aircraft cleaners, people that clean the insides of the planes, are saying, wait a minute, we want protection, we want counsel, and some medical people are saying, too, tell us what to do. And in New York, some cleaners went on strike until they get better advice and specifics. But I think that happened at LaGuardia Airport in New York. But it's very scary and uncertain, and the feds don't want us to panic, but there's reason to be extraordinarily concerned, whether the Dallas incident that was mismanaged at first, other places too. And I read that about 150 people a day from the ravaged regions come into this country. You multiply that out per month and per year. So, again, what's mishandled and how it should be, and the panic and the politics even of this, we're going to have to keep watching.
Yeah.
Well, it's frightening. It's affecting airline travel and airline stock market.
Well, I think it's more frightening. I mean, it's not a reason to panic. It is a reason to be concerned and also pay attention to it. That's for sure. And I do understand the apprehension of the airline workers, and they should receive the training and the materials that they need, and they should receive it pronto. I agree. But I think what needs to be addressed, and it's not being addressed quickly enough because it seems like everybody wants to sit on their hands, is if you really want to deal with this situation, you're going to have to go to West Africa and deal with it. These countries are ill-prepared. They lack the infrastructure. They lack the resources. Yes, a lot of it is of their own fault. The governments are inept in that part of the world. But now we're starting to see that things that do happen on the other side of the world can have an impact on us. And it is in our best interest at this point to rush a whole bunch of resources over there as quickly as possible to set up hospitals and set up medical infrastructure to get this thing under control before it gets completely out of whack here.
And you talked about the U.S. military, a couple thousand, 3,000 U.S. military troops are going over there again to nation build or to handle the infrastructure.
Build
At
hospitals,
first it was
basically
denied they would not be in contact with patients. Now we hear some medical units of the services will be handling bodily fluids. And, these nations...
Tissue samples, blood samples.
These nations are... When I first started teaching geography, things were more honest, and we call them backward nations. Then the political correct folks took over the geography books, and then they were called emerging nations. But then people said, well, if they're emerging, they must have sunk. These units over there were better off when the European colonialists ran them. They're backward, and let's just say that, and they're uneducated, and they have corrupt leaders. That's why it's so serious there. Liberia is a little bit different. It's more sophisticated. The U.S. has dealt with Liberia for decades, for a century, but it's chaos. And you go there, and the public that isn't informed riots, or they don't pay attention to their instructions or quarantines, or they attack aid workers, international aid workers and domestic. It's not easy. And because of all that, there are going to be loopholes, there's going to be tragedies, and it's going to spread, Andy. I think there is reason to panic.
I disagree completely. I think that if the international community mounts a concerted effort to assist the people in West Africa and deal with it before it turns into a wildfire, then it can be, I'm not going to say easily controlled, because every day that passes, it gets more and more difficult to control. But I think it would be far better to extinguish the flame in West Africa than allow West Africa to become a hot zone and have an unbelievable humanitarian catastrophe and economic catastrophe.
But it is a hot zone, and then you got these people going to Europe.
If you wall it off, you're going to have people escaping from it.
They're going to escape anyway. They got visas to Europe. Now, Britain isn't allowing any aircraft from those countries to come in, but a lot of these people have visas, and they go to Europe, and then they can come here on a plane, and airports are supposed to take their temperatures now. Who's going to do that, and what do you do to dispose of the temperatures.
Well, they're an infrared reader. You don't touch the person. Yeah. You come up to them and you aim it at their forehead, and it uses a reflection.
You don't
of
touch
light.
them. What if they sneeze? What if they cough?
It's not an airborne infection.
You don't know that, Andy. The epidemiologists are arguing about that because viruses mutate.
They have the potential to mutate, but at this point in time, there is absolutely zero evidence that this thing has mutated or has begun to mutate, and they are monitoring it in West Africa very closely to watch out for that. So, I mean, at one point you have to take what is called a rational fear and deal with that, and then there's the irrational fear that we all have. It's part of what we all live with because the idea of a worldwide pandemic is always out there, and it's always a possibility.
It's already a pandemic.
No, it's
the numbers
not.
of thongthousands of people that have been affected.
Epidemic is different than pandemic.
And pandemic goes across borders, Andrew.
282-1234 is the number. We'll take a call, Tom. Good morning. You're on KROC.
Hello.
Hi there. You're on KROC Radio.
Hi. I was wondering, now, if I was coming over and I thought I had it, I would take a lot of Tylenol before I landed. Then my temperature wouldn't show up, would it?
Well, that's it. They can medically examine people, and if they don't have the symptoms, they don't have the temperature because there's an incubation period. People can be fooled. Yeah.
Okay, thank you.
Yep, thanks.
You bet. Well, I don't know about the Tylenol. I'm not a medical person. Maybe Andrew has opinions on that, too.
I'm just...
And by the way, you're wrong. A pandemic, I taught epidemiology and medical geography. A pandemic is when a disease crosses an international boundary, and it's done that already.
But I also want to... You're dealing with, getting the numbers is very difficult.
Yeah.
I'll admit that, because in Africa, the reporting is... number one, difficult to obtain, probably dishonest in some ways, and there's a whole bunch of factors. So you're going to probably multiply the numbers that you have by some sort of factor because of the unknown.
Yes.
We know of about 3,800 deaths. Those are confirmed. So let's double it, okay, or even triple it. So you've got 10,000 deaths. I think that's a reasonable extrapolation. And if you're going to go 50% our mortality rate on this thing or higher, I'm going to go out to 20 to 30,000 people have contracted it. Okay, I'm going to give you 50,000. You have between 20 and 25 million people living in these West African nations. Mm-hmm. I'm just trying to put it in perspective. It is a huge, nightmarish problem. I'm not trying to minimize that at all. But to panic about that is another level. I'm saying everybody should be concerned about it, and everybody should stay alert about it. And if you're dealing with cleaning airplanes that are coming on international flights, you have every reason to want training and expertise to deal with your job. But don't freak out. If you really want to be worried about an infectious disease in the United States today, you should be worried about influenza. Influenza will kill 30,000 people in the United States this winter.
Well, our president said you can't be in danger just sitting by someone in a plane that has it.
Well, you could,
and
too.
the Center for Disease Control said, yes, you can.
Yeah, he's incorrect on that because the sweat can carry the virus.
And coughing and sneezing has fluids in it.
Actually, they said well, I'm not going to say that because you got a point there. If you're coming to physical contact with the fluid.
Yeah.
But the air particulates right now. Okay, we got to take a break. We can talk about this all hour, Thomas.
Thank you, doctor.
No. I have good friends who are involved in infectious disease, and they work in this big building over here. And I know one guy who was at one time considered an expert on some of this stuff, and they're telling me these people are not politicians; they're experts. They're telling me panic is not warranted.
Well, it depends on how you define panic, but go ahead.
Okay, we got to take a break for news. It's 282-1234 is our number. We do have a couple calls we can take after the news break, but we have to take the news break before we get too late on that. It's 45 in the downtown at KROC-AM. News Talk 1340 KROC-AM. I'm Andy Brownell. Tom Ostrom's here. Rochester Today on a Friday, and 282-1234 is the number. In time, we've had a caller patiently holding all the way through the break. Thanks so much for doing that. Good morning. You're on KROC.
Yes, in talking about Ebola, I would like to see them quarantine these people like they used to. They'd bring them to Ellis Island, and they'd keep them, for a couple weeks or something, and I'd like to see them do that instead of just taking temperatures. I think it'd be a lot more successful. They'd find people that would, if they were contaminated, they'd come down with it within 30 days, and then let them, if they didn't have it, let them go.
Oh, Tom, I got to turn your... Wait.
Well, it's
sorry,
okay.
my problem.
Andy turned my mic off. He turned my mic off because we disagreed. But, yeah.
I deny that allegation.
Okay. There's no credible evidence, as the White House says, of... Okay.
I don't know what the caller... Yeah, that was the practice, right? But that was also the practice before we had modern medicine as well. And an actual... working knowledge of how viral infections work and bacterial infections. And at that point, that was probably the only option they really had. It was to say, you're going to sit over here for 30 days until we know you're not going to develop one of these
and
things.
I'm pushing the panic button, and you're not.
I'm not.
And now the race card people are getting into it about aggressive treatment or isolation or quarantine or concern is racist because of the black African population. So politics is getting into this, but
yeah, it is.
But it's a public health thing, and we'll do what the experts tell us and have hope.
And just try to pay attention to it. And as I was pointing out as well, in the history of viruses, that they once the critter gets out into the wider population, as some experts will tell you, there's a possibility it could become more virulent, and it could also become more easily spread. But there's also the possibility it could become less virulent, and your body could more easily handle it as well.
So there's lots of possibilities.
Anything is possible.
And that's why I'm panicking.
Or we could, as a concerted international effort, deal with this in West Africa, get it under control. In Nigeria, they managed to do it. But they haven't said what steps that they used to do it. I know they were very aggressive in doing it and isolating the folks who did have it and doing the quarantines that were necessary.
But you can bet if mass quarantines take place, the civil libertarians will be harping.
But there's already been a past history, even in this country, where when you have a public health emergency, civil liberties go out the window right away.
Okay.
So you want your paranoia that this is all hatched as part of a mass conspiracy to put in martial law, and it's not even really happening now. There's your science fiction for you. If you can accept that that's a lie, then all of it's a lie.
I have no idea what you said. Take a call.
Good morning. You're on KROC.
Andrew?
Yes.
Okay. Question for you and your medical friends at the big building.
Well, he's not here, so I can't tap his knowledge right now. But go ahead.
Well, you'll see him because you're a friend. All right. I have a wife and kid, and there is nobody on this green earth of ours that I would trust putting my wife and kids in a room with someone that has this Ebola, and knowing or not knowing that, and Tom's right, it's supposed to be just a bodily fluid transfer to another person. And coughing and sneezing and wiping your nose and all of that, I am 100% convinced that there are bodily fluids in those actions, and they're natural actions that we all have from time to time. My concern is, and I would challenge you and your medical friends, that if they don't feel that there's a potential there to put their family, their wife, their kids, their mom, their dad, their grandpa in a room with someone who's coughing and sneezing and see how comfortable they are, I'm not willing to put my family at risk. And if other people are, then that's fine. And I read everything I can about this. I try to be informed as much as I can. My idea on how to treat this is, I'm a little bit afraid of them bringing sick people here. I think maybe we should have a place, take one of the old Navy ships and float it out in the ocean and put all of our medical technology, and we are the leader, put it all on that ship, and anybody that's sick, treat them out there until they're well, and then bring them here, you know.
And the brave medical
And you're right, Tom. There's going to be some brave medical people that have to deal with that. But that's my not 2 cents. That's probably about 7.5 cents. So
Okay.
I'll hang up, and then you can respond.
All right,
Thank
thanks
you.
for
Sir,
calling.
did you say you had or did I misunderstand, as I do often in life, did you say you had a medical license? No.
No,
Oh.
I have a jeweler's license,
Oh, okay. Okay.
but I've raised a couple kids, and we learn a couple things once in a while.
You do,
So I
don't
do
you?
I do not have a medical license whatsoever.
But
And,
you've done some reading. Thank you.
I try to be informed. I just, to not do that is a disservice to yourself, and then you don't open your mouth till you do some homework. And I've tried, and we're all learning. Unfortunately, we're learning with something that's very, very, very dangerous, and it's troubling to us. It's troubling to the world. But all right, your turn, Mr. Andrew.
Oh, my turn. I get everything he said, and I understand the sentiment. Maybe it's irony is that Ebola has been known for quite some time. It has been outbreaks in the past that have been dealt with, and this obviously dwarfs anything that's happened before. This thing is unprecedented. But the infectious disease folks will also tell you that the pandemic that will cause the most harm will likely not come from something like Ebola. It'll likely come from something that is somewhere in Southeast Asia where some pigs and some chickens are nearby, and there's human populations very close by, dense human populations where sanitary conditions are not good, and some sort of swine and avian virus get together and create some sort of new virulent mutation that spreads rapidly through the human population that is airborne that we've never even heard about before, and we have absolutely no idea how to battle, and it has more in connection with influenza than it does with something like this. And that is the one that gives me nightmares more than this Ebola business.
That's right. But we do know about this. It's here, and it is virulent, and it could mutate. So I'm not going to speculate about what could come that's worse. This sounds pretty worse to me.
Not as likely to mutate in that way.
How do you know,
Because
Andrew?
the experts will tell you that...
Experts differ. The guy that discovered Ebola said he's concerned.
Well, of course,
about
everybody's
about,
got to be...
about our not handling it well, and it's more dangerous than he thought it would be.
Okay, I'm not...
And he discovered it.
You're mistaking my not panicking for not being concerned. I am concerned.
Yeah.
But when I hear from medical experts, not pundits, medical experts, even those in our own community who tell you that when you have a virus that is spread in this way, it can mutate. It is a possibility it could mutate to an airborne, but it's not likely to mutate to an airborne.
And the medical fraternity wants you to have faith in them, unlike the Dallas response initially. And so, of course, they're going to say,
and
we're
you know
in
what?
charge, have faith, we can handle
And
it.
I go
They're not going to say, ah, like I do.
And I do go get my children vaccinated, and I get myself vaccinated because the medical experts tell me that it is the thing to do because it is the best way to prevent these kind of things from happening.
Yeah.
And I hear people out there, wackos, who tell you don't get your kids vaccinated.
But some medical
And they got
people,
whooping cough running all
some
over the
medical
place.
people are saying our government's lying to us, and you and I choose the medical people that that respond to our perceptions. Let's put it that way.
Okay, 282-1234. It's Ebola Hour on KROC-AM.
That's terrible, yeah.
Good morning. You're on with Tommy and Andy. Thanks for calling in.
Hello, is that me?
Yes, it
Yes.
is.
The Ebola Hour, huh?
That's what it's turned into.
Well, I've been listening I listen to your show, as you know, because I'm a huge fan. But I disagree with you, Andrew. I'm 100% in the camp of Thomas Ostrom.
I gather that is the mood today.
That, first of all, they are doing experimental treatment. That we're hearing that even on the radio. We don't have a known treatment for Ebola. You know that it's a proven, and that's why I have concerns about it. I also do not believe that it comes only from bodily fluid exchanges. I think
Why do you have that belief? Because you just have a distrust of all authority, Norm?
Well, right at the present time, Andrew, and I will say this publicly, zero do I believe that comes out of Washington, D.C. I don't believe anything. I could stand in a rainstorm and they could tell me it's raining and I wouldn't believe them.
Would you believe it if you ran into one of these docs who are infectious disease experts at the Mayo Clinic who are shopping for groceries at the same store as you do and go to the same restaurants and they're not have anything to do with Washington, D.C.?
I would have to talk to them and do some questioning of my own about it.
Okay.
I have tremendous respect for the medical people at the Mayo Clinic, and I'm a patient of the Mayo Clinic, but I just have fears that this thing could be much worse than than it's made out to be.
Just last Saturday on the Mayo Clinic radio program, which is with Tom Shives and Tracy McRae every Saturday, they had one of the top guys from Mayo, and I wish I could remember his name right now. Unfortunately, and he connected with him for the program, and I guess he was even. You take two ends of the spectrum with Tom on one end and me on the other.
Tom and I.
Thank you for that. This is the way this day is going, isn't it? That he would have been past me on the other side as far as the non-panic part of it.
Don't you feel that probably his position should be one of providing comfort?
I think. Well, obviously,
to the peons like Tom and I that don't understand medical situations.
And I think it's better, in my philosophy, it's better to overreact than underreact. If you underreact, the problem disseminates. If you overreact, you crush it, and then throw the civil libertarians in there. But anyway.
I got to take a break.
Hey, just one thing.
Okay.
I would say that girlfriend of this Duncan down in Texas that died is probably infected with Ebola.
Well, I would say probably not. I would say that if she's already...
Tom,
she's past 10 days out.
It's a girlfriend. He came over to see her. He probably kissed her, and he may have even had intercourse.
And I would also point out to you that may be evidence of how difficult it is to transmit this thing in certain cases. I mean, she's already past 10 days out. Granted, we've got another week or two to wait to see, but things are looking pretty good for the...
Isn't one of the physicians that was treated with the miracle drug that is in short supply? I think he was readmitted for recurring symptoms again, unless it's just flu.
And they kicked him right back out again. He tested negative for it, just like the deputy down there did too. And
are medical tests sometime erroneous?
Oh my God. Yes, but at some point you have to accept that life is dangerous. We have to live our lives somehow. Things are going to happen, and you can't freak out about this kind of stuff.
We agree. Well, things that are dangerous are worth freaking out.
I know, but it's on the other side of the globe at this point.
It's in America.
One case.
So what?
One case.
So
in a country of 360 million people, it's also 1,500 miles from here. Okay, you got to take a break.
That's been identified. Gentlemen,
thanks for starting all this fussing.
You brought it up.
Oh. Let's go to something else.
Here's something. We're going to shift gears to something completely pleasant. And if you have concerns, and this show has not helped you with your concerns, and you want to relax, just go to Victoria's Restaurante and Wine Bar and enjoy a nice lunch, have a glass of wine, look over their menu, get some delicious pasta dinners. You don't have to have pasta. You can have pizza. You can have a delicious salad. Just enjoy the calming ambience of Victoria's Restaurante and Wine Bar.
Chicken and pork, mushrooms, pasta. And you can get whole wheat pasta, too, if you're counting calories. And they'll advise you through that complex and beautiful menu and give you the special of the day. And you can even tell them if you got a special dish in mind, like I did the other day. I went in and talked to the gang, and I had a wonderful glass of wine from their award-winning selections. They helped me get ingredients for a huge soup I was making, with mushrooms and onions, and the onions were sautéed, and the chicken, and they're just so helpful there and so nice, and their expertise at catering and everything else. You just can't go wrong.
You brought up the catering. We have to bring that up as well. Think of Victoria's as you're planning your events over the next few months. Holiday parties are coming up way quicker than we can imagine. You got office events, birthday parties, whatever it may be. The pasta bar method of doing it that they do is an awesome way to have an event catered. They can bring you staff to help you out as well. That's Victoria's Restaurante and Wine Bar in downtown Rochester. It is 5 minutes away from 11 o'clock, and Tom Ostrom's here with myself, Andy Brownell, and we have full phone lines going and have had all hour, so we'll try to take care of some of that. Good morning. You're on KROC. Thanks for holding on.
Yes, I would like to preface any comments I make with the fact that I was in the sterilization and decontamination field for about 30 years.
Oh, great.
So I know about some of that stuff. And I've got a couple of questions, and I think these are more to Tom's way of thinking perhaps than yours. But number one, bodily fluids, and they have stated that the bodily fluids could be sweat.
Yes.
So my question, the follow-up to that part of it is, how long is that virus viable outside the body? A lot of viruses die almost immediately after leaving the host.
Well, my guess is quite some time by the steps that they've taken to disinfect that guy's apartment.
All right. So, the second part of my question would be, how difficult is this virus to sterilize, to kill, to decontaminate? They're using bleach. Is bleach an adequate decontaminant? I don't know if it is or not.
I don't know either.
How long do you have to sterilize it? For most things, you have to sterilize using steam at 250 degrees for 30 minutes or more. Some viruses take a significantly longer time frame than that to kill and sterilize. That's in the proper machining. That machine used to sterilize it.
That's an autoclaver, right?
Yeah, well, it's sterilizer, autoclave, whatever you want to call it. But so that's a couple parts of it. Now, if it's bodily fluid, why then is not a sneeze a means of transmission? I would think that would be a primary means of transmission.
Boy, oh boy.
Like tuberculosis. Yes, sir.
Tomorrow morning, the docs are going to be in for Mayo Clinic Radio again. I'm going to ask them.
Sir, you're a scientist with some experience here. How's the difficulty of creating a medication for it? Evidently,
I have no experience in that. I just worked on equipment and things like that that used to do the process.
But the evil pharmaceuticals that make so much profit so they can do research, I'm sure they're trying to do it.
Absolutely. And it's like so many other sicknesses, diseases, and I'm not trying to hog all of the phone time here, but some people may be more susceptible to that particular virus than others. You mentioned the woman prior to that. There's people that have inborn
immunities.
Yes, and to things even as severe as AIDS. There's some people that have antibodies in their blood system that they don't come down with AIDS and things like that, which is actually AIDS. The virus dies fairly fast.
And going along with your immune thing, some are saying put the blood of a disease of a victim into someone else, and maybe it'll counterbalance. But
they're trying that. They've taken some blood from that first doctor to do it. And at this point in time, we probably don't know how many actual cases there are in this country.
Okay.
Thank you.
How many people have passed that had this that we don't know?
Mm-hmm.
And I'm not trying to be an alarmist, but these are just questions that come to my mind.
Well, they're pretty good. Thank you.
All right, thanks, folks. Have a good one.
Yeah, you too. Thanks for the call. And boy, oh boy, we are just out of time, Tom. That's what it is at this point. I have to mention, if you want to hear a replay of the show, if you missed part of it, we've been busy today, to say the very least. You can check it out on KROC-AM.com later on this afternoon. Look for Tom's picture, I'm sure, or maybe even, you know what I'm going to do? I'll probably put a picture of the Ebola virus up there instead on this one.
Shouldn't kid about it, but you almost have to stay safe.
Well, you have to. It's out of your control. Mm-hmm. It's one of those parts of life that, and I understand the fear of it completely, and I'm not going to say I'm immune from that fear, but I guess I'm trying to control it as well. Next Tuesday, you're going to be here, Tom. I look forward to that.
Yes.
Next Friday, Tom's on assignment, and next Friday, what we're going to do is the sheriff's candidates forum. So we're going to have Sheriff Dave Mueller on, and we're going to have Captain Kevin Torgerson on, and they'll be talking about why they want to be sheriff of Olmsted County. That'll be next Friday, the 17th.